If you haven't already done so, make sure that you are subscribed to Nimdzi Insights. We are coming to you live today on LinkedIn, Facebook, Twitter, all of that stuff. We scheduled an event. The event, LinkedIn decided they didn't like that event, so I'm sorry if that you joined that event and the live stream got shut off. That's why we're coming to you live again right now on the LinkedIn page. So welcome. We should see people trickling in here once they find out where the new live stream link is. For those of you that don't know, Nimdzi partners with Multilingual Magazine. I'd just like to give a quick plug to them. If you are not familiar with Multilingual Magazine, then you are missing out. The latest issue is right here. Check your mailbox for those print subscribers. It'll be coming in the next week or two for the September issue, I believe. If you'd like more information about Multilingual Magazine to find out more about the translation, interpretation, localization industry, and all of that stuff, head on over to multilingual.com and see how you can get a digital and or print subscription. We also have daily industry news published via the website. So check that out to stay on top of all of the current events. So without any further plugs or rigmarole, I will get right into it today. Today we have something that I've been meaning to set up for quite some time. We are discussing language access plans and policies. What are they? Why are they needed? How are they created? For those of you that don't know, Nimdzi Insights works regularly on language access plans for state and local governments. It's a big part of what we do here. I've had the pleasure of collaborating with our two guests in this work, and today we have set up a live panel discussion on language access plan development. We have two experts joining us today, Dr. Bill Rivers and Carol Velandia. I'll just give a quick introduction here about Bill. Dr. Rivers is a seasoned expert in language and culture with over 25 years of experience. He has had leadership roles in national language organizations, worked in government and academia, and conducted extensive research. His expertise opens language acquisition assessment, policy, and economic development. He is fluent in Russian and French. Welcome, Bill. Carol, our next guest. Carol is a champion for equal access to public services for those with limited English proficiency. She runs a language access services company and advises organizations on better serving LEP or limited English proficient communities. Her expertise includes navigating language access laws and regulations, designing language access plans, and resolving communication barriers. She is also an educator, creating programs for social services professionals, and an award-winning advocate for the LEP population. So welcome to Nimdzi Live, Bill and Carol. It's so good to have you here.
Thank you, Tucker. It's a pleasure.
Yeah.
It's my pleasure.
Bill, you and I talk pretty much every week because we're working on different projects together. But Carol, we just recently got the opportunity to collaborate on something, and I was really impressed with your knowledge and experience in this area. So I'm glad that I get these two experts to kind of pick your brains on language access policies and plans. And today, I'd like to keep the conversation just because that's kind of where my experience is. When we're talking about language access policies, we're talking about government, and that can be city governments, it can be county governments, state governments, federal governments. But I want to keep it kind of in the framework of language access and the policies that are created there around that in government. So with that kind of order around the conversation, I'd like to turn, and maybe I'll start with you, Bill. For our listeners, for our viewers, what is a language access plan? What is a language access policy? Why are they needed? Go. Open question.
Yeah, so language access really very basically means that whoever your customer is, and this is in the context of federal, state, and local governments and those entities which receive funding from the federal government. So that's basically all of healthcare, all of the educational system, where whoever's coming in the door gets interpreting if they need it. They get documents translated or site translated if that's needed. It's founded on a principle of Title VI of the Civil Rights Act of 1964, which bans discrimination against any person in the United States when they are in a position where they might receive benefits from or engage with any organization that receives federal funding. So it's really That's all state governments, by the way, get federal funding, all county governments, all schools, and pretty much every pharmacist and doctor's office and hospital, thanks to Medicare, Medicaid, and a bunch of other programs. And so that's the legal underpinning. There's a social justice underpinning that you have to think of 70 million plus, probably closer to 75 million people who speak a language other than English at home as their primary language. And of them, about 25 million who are limited English proficient. In other words, whose level of English skill is not enough to engage with the doctor's office, the county permits office, et cetera, et cetera. And you have to be able, they have every right as citizens and residents of the US to receive these services. And you, as a covered entity, that is an organization that is receiving, a governmental organization otherwise receiving federal funds, you have the obligation to provide that service.
So it's really it's not really an option for most agencies out there. It's kind of mandated by the federal government. I mean, technically it's not mandated by the federal government, but if you're receiving federal funds, which, let's be real, most agencies are, then you're required to do this, correct?
Correct. And I would add, Tucker, that, or rather, I would emphasize the fact that or language access plans are aiming to really diminish discrimination or prevent discrimination of the limited English proficient population. So that focus is really important, and the focus on effective communication in everything that you're doing, in any program, in any service that you're providing, effective communication and equal access.
So there's a
And I just want to add one thing. It is mandated to have language access policies under Section 1557, Patient Protection and Affordable Care Act, also known as Obamacare, also known as the Affordable Care Act. The regulations that implement Section 1557, which are 45 CFR 92, that's the Code of Federal Regulations, Volume 45, Chapter 92 thereof, mandate that you have a policy in place for non-discrimination, and that non-discrimination policy must include language access. So that's, when you talk about, okay, it's mandated just in healthcare. Healthcare is like the biggest sector of the economy.
mhm.
It's something like, I don't know, a quarter or a third of the U.S. economy. So yeah, those plans and policies are mandated, and the access is mandated. And if you America is diverse everywhere now, and more so than it ever has been in its history. Total numbers, percentage of people who come from somewhere else, or parents who are born somewhere else, or speak another language, and it's everywhere in the country. It's worked really hard to find a place that is monolingually English speaking nowadays, that doesn't have multiple languages. As Tucker knows, I was in Down East Maine, Washington County, Maine, and you've got Spanish, but you also got Zapoteco, Mixteco, Triqui, Haitian Creole, French, West African French, and a number of other West African languages, in a county of 23,000 people, where you think, okay, that's down east, it's way past Bar Harbor.
Mm.
And you think, well, that's probably going to be pretty monolingual. Actually, no, it's not. So if you don't have a plan in place, you're going to run afoul of civil rights law. And how are you going to deliver your service? And it's just like localization. If you've got a multicultural, multilingual clientele, and you aren't ready to meet them where they are, well, you're going to have problems. And you need to plan for that.
Yeah, so you're mandated to have a plan. You're mandated to, and not just a plan, you're mandated
For healthcare.
For healthcare, right? So you need to have a plan and a policy around this. Now, this reminds me, and we've had these conversations before, Bill, is the reason I think you don't see a lot of companies, or not companies, a lot of government, there's governments out there that still don't have policies and plans around language access. And I think the reason that you see that is because there's a lack of knowledge, lack of understanding, and not just with the local governments, but also with the communities that these policies are meant to serve. A lot of immigrant communities, a lot of LEP individuals, they're not aware of their rights. They're not aware that they have a right to equal access when it comes to language access in healthcare, for example. And I like to compare it to the deaf and hard of hearing population, who are also protected. There's laws governing their right to an interpreter, right to access, all of that stuff. This is a population that is very aware of their rights, and they self-advocate, which is great. And unfortunately, LAP communities sometimes aren't even aware of those rights. Carol, maybe you can talk a little bit about your experience working with these communities and how you've seen that play out.
Yes, I would say a couple of things. I think that many agencies, many organizations actually do have a language access plan or policy, but the employees often don't know about these plans because there is a vast lack of training. They are often insufficient as well. But from my experience working as an interpreter in healthcare, I had the fortune to work for one of the top hospitals in the nation and remember clearly unearthing the language access policy that was well written, but nobody applied it because there was no training on language access. So there are policies, but they are not implemented yet because of lack of training. And you mentioned something very important. Yes, the deaf and hard of hearing population have a very solid identity and they advocate for themselves. They know about their laws. The limited English proficient population is a separate kind of population in the sense that there is no a cohesive identity. Like you can find a person that speaks Mandarin, a person that speaks Spanish, and they don't have anything in common other than the fact that they don't speak English. And frequently they don't know that specific right. And this is one of the big challenges and why I think it's so important that linguists, interpreters in particular, tell them when they encounter them that they have a right to get effective communication or a right to language access by any means necessary. But it's that lack of identity. And now the other thing that it's important to mention here is that the cover, and I don't want to open a can of worms, but the laws that protect the deaf and hard of hearing population are different than the laws that protect the limited English proficient population. And this is important when it comes to enforcing them.
Right, because with the disability, it's not, or with the deaf and hard of hearing population, it's covered under laws pertaining to language access, and it's all but more importantly, it's covered under laws regarding to disability, Americans with disabilities. Right?
Correct, and that is why I think we need to shift our thinking when it comes to language access to think that this is a matter of discrimination. Discrimination looks the same whether you are a deaf or hard of hearing person than if you are a person that doesn't speak English. If you're not providing language access, you're discriminating. So yes, it's hard to say, yeah, we couldn't say a person should be covered because they are disabled, right? Like in terms of the limited English proficient person. But what we think about is that you are discriminating if you are not applying language access services to them. That's where the focus should be.
Right, and in doing that, you may be violating Title VI of the Civil Rights Act. You may also be violating Section 57 of the Affordable Care Act. You may also be violating part of the Americans with Disabilities Act all at once. And the point about identity is, I think, really critical because just take a guess at how many languages are spoken in the United States right now. Anyone want to guess?
No, I don't.
430.
We have 400.
All right. So
I'll do the Price is Right strategy and say 401.
The old Price is Right. All right. Tucker wins because he bid closest but didn't go over. It's close to 1,000. The city of New York alone has 700 languages of lesser diffusion. Wow. That doesn't count, major world and regional languages. And then you add it. So that's a baseline you can take. There's a linguist there named Ross Perlin, wrote a book called Language City, came out this year, mapped all these languages, right? And he works on maintaining them and reviving them, helping people pass them on to the next generation. You take 700 as a baseline, plus 150 or so Native American languages, and then languages that are maybe spoken in LA, hyper-diverse place, Bay Area, that aren't spoken in. So, you're starting at a baseline of at least 850, and I suspect it's much higher. And then the enforcement, what that means and so, okay, well, there's 60 million Spanish speakers in the U.S. Well, they come from 25 different countries, including the U.S., by the way. They speak widely varying dialects of Spanish,
Right.
Um, and they have their own individual backgrounds. Like coming to the U.S., people come to the U.S. as my ancestors did for opportunity or to escape repression, as they were escaping British repression in Ireland, and and they come here for broadly similar reasons, but the specifics can be really important too. Are they, so to say that there's a cohesive, it's looking for a cohesive identity, as Carol rightly points out, there's not going to be one. There's also a fear of engaging, often a fear of engaging with the official bodies of power.
Right.
People might have legitimate reasons to be concerned about immigration authorities. Immigration. They might have experiences in their home country where you didn't talk to the government, any official government, unless it was absolutely necessary, and usually not by choice. They're busy leading their own lives, right? So asking people to go out and file a civil rights complaint, which is how enforcement works for violations of language access, is asking a lot.
Well, yeah,
I do think
they're being
we can
asked
do more about.
I'm sorry, they're being asked to put their name on a piece of paper and give that piece of
Right.
paper to the government.
Yes, and I'm so glad that Bill brought that up, because many limited English proficient persons are immigrants. And I think it's important for us to also know and understand the many levels of oppression that an immigrant, especially an undocumented immigrant, has gone through before we oppress them a little more by not providing language access. So imagine a person that comes from El Salvador, where there was a civil war, and then the gangs are a big part of the culture, and they are fleeing the country because they are fleeing violence. Their families have been threatened. They have been threatened. They come through a coyote, for example, risking their lives, right? So they are fighting, or they are fleeing poverty and violence. They come to the United States. They experience more poverty and sometimes more violence. And then the worst thing that can happen, they get sick, or they get in some kind of trouble with the police, or they end up in a court of law. And now imagine that person has gone through all of these levels of oppression, all of this victimization, for any service provider to be like, oh, we don't have an interpreter, or we can't provide this document in your language. So I really want people to think about all of these steps so that we understand that it's not only mandatory, and there is some fear instilled in us to provide language access, but also that aspect of compassion and humanity. I mean, we are oppressing them once more when they are sick and when they are at their worst. So I want people to think about that too.
It's a really good point. And just some points of clarification here.
I'm sorry, Chuck. Go ahead.
Please. Oh, just one point of clarification that I'm sure you guys will have the answer to. Carol, you rightly bring up the case of undocumented immigrants. Now, when we say that everybody has a right to equal access to government services under the law, does that include non-citizens? And I realize I just alienated a whole portion of my audience by referring to them as illegal aliens. But you know what I'm saying? Undocumented immigrants. Do undocumented immigrants have the same rights to equal access to government services?
To government services, unfortunately, not all government services. Okay. But when they are at a hospital and when they require services like in healthcare, the court, or when they are or law enforcement or some social services, they not only have
education,
the right to have an education, certainly. They in top of the rights that pertain to those particular services, they do have the right to effective communication. And this is regardless of your status. There are equal protection of the laws for any person that is in the United States when it comes to certain programs. So I couldn't respond to or answer regarding all of the federal programs. They are not eligible to many federal programs, but when it comes to these basic services, they not only have the right, they have the right to have effective communication, to be informed about their rights, like in the case of the police, to have a due process in the case of the court, to have informed consent in the case of the hospital, to have access to education, and effective communication.
Yeah, it's very important that when I cited the law verbatim, no person, it doesn't say no citizen, no legal resident, no person. We have data from the Migration Policy Institute regarding English learners in school. English learner is the term used in the Elementary and Secondary Education Act for kids who don't speak English when they come to school. And that's about 10% of the US school population. More than 80% of those children are citizens or permanent residents. So, yes, there are 10 to 12 million undocumented residents in the United States, and that's not a trivial number, but it's like 3% of the population. It's also not, a huge component. It's a bigger proportion of LEP, but even then, 80% of the LEP folks probably, certainly 80% of people who speak a language at home. I'm a linguist, not a mathematician, so take these numbers advised with caution, are going to be citizens or residents. But it doesn't matter. If someone shows up in the emergency room, there's another law called the Emergency Medical Treatment and Labor Act, EMTALA, requires that they get treated, whether they can pay or not. They're not out. Hospitals or ERs are not allowed to ask about their residency status, their immigration status, or anything else. So the bottom line is, people who come in speaking another language are going to be, if they are eligible for the service that you are providing, you are required to provide language access. Now, there's the social justice component, there's the legal component, and we often find, especially in healthcare, that language access services typically have been managed by, risk compliance, legal department, because of the risk of being investigated based on civil rights complaint. There's also an economic and a healthcare case in particular. There's a body of research for the last 30 plus years showing that when language access is provided, patients have better outcomes. They have better adherence to instructions. They follow the instructions better. We have to have our own jargon. So that's discharge instructions, post-operative instructions, prescription instructions. Like, you want your patients to take the right number of pills at the right time. Not to skip them, not to take too many, depending on the medicines, right? Lower rates of readmission.
Yeah, Nimdzi actually compiled some data around this. Like, let's say I'm a fat cat hospital group administrator, and I don't care about the social justice aspects or any the fairness or any of that. There's an ROI to providing language access, because you're going to get lower readmittance rates. You're going to get a shorter length of stay for the patients. There's a very real ROI, and there's data to back it up.
And if we think that healthcare is 1/5 of our economy, and there's also a body of research of the type of wasteful spending associated with healthcare, and part of that wasteful spending is in communication, patient safety issues, right? The frequent flyers of the healthcare system are people that don't speak English, right? So yes, the outcomes will compile to a point where it's really detrimental economically to any healthcare system. So the motivation here, not only social justice, as you said, but also economic reasons for any hospital.
Yeah. Absolutely.
And since we're on finances and economics, and maybe it's not fair to answer this question because I don't think there's a good answer out there, but let's see what we can come up with. Okay, agencies are required to provide language access. Certain agencies are provided to provide language access, not just in healthcare, but in other government areas as well. Who's required to pay for that?
The agencies, the patient or the customer. So, you could have like the county's permits office. You want to put a porch on your house, and if you don't understand the forms and the requirements, they're supposed to provide language access. The licensing office at the state level, and Maryland has actually been an early leader in this, providing licensure exams for all sorts of different jobs, general contractors, plumbers, um, barbers, hairdressers, professions where you need a license in order to practice, providing those exams in other languages. The DMV, right? Somebody comes in and they have a right to get a license. You have to be able to test them in their language. You can't say, "Well, come back when you fluent English," or bring somebody with you next time. That happens far too often. But all of these agencies are supposed to provide. See, the thing is, the way Title VI of the Civil Rights Act of 1964 works, if you're a covered entity, right, you're providing federally funded service, and it's not just the services that are specifically funded by the federal government. If your agency, your entity, your local park and recs gets money from the federal government through the state, and it's maybe whatever small percentage of the budget, all of your activities fall under Title VI.
Right.
The same thing if a hospital or pharmacy takes care of one Medicare patient or one Medicaid patient, all of its patient-facing activities fall under Title VI. So it doesn't matter how much money, it doesn't matter how many steps it get, between the federal government and the entity. So, and you're not allowed to discriminate. In the federal government, the taxpayers, we don't pay you extra for not discriminating. That's kind of how it works.
Right.
In the real world, I think that's an important point to remember. But in the real world, then it becomes an unfunded mandate. And what we do see is far too often a drive to minimize the cost of providing language access. One of the things that happened during the pandemic, in March of 2020, CDC shut down severely restricted access to healthcare facilities. You could go in if you were a patient, and someone could help you if you needed assistance, like ambulance. If you needed someone to push your wheelchair, some other disability. That led to a spike in billings for remote interpreting. And this included major healthcare systems, notable, nationally renowned healthcare systems had a spike in their remote interpreting billings because the friends and family plan was no longer available. Okay, you couldn't have, your EO or your EA interpret for you in your OB-GYN surgical consult, right? And it's really important to note that even because it's an unfunded mandate, because there's a lack of awareness, as Carol pointed out, I'm sure the director of the hospital she worked at, the senior leadership understood. But once you start moving down the ladder, you get to the middle management and the line managers, the people on the front line, if they aren't being trained, if they aren't getting recurring training, if there's not an easy button, having an internal web page with a whole bunch of different numbers to call is a little different from, something right there at the desk says, dial this number if you need an interpreter, right? And do it now, right? And all of that's part of the language plan. The policy says you're gonna provide language services. The plan says how you're gonna do it. Part of that plan has to be recurrent training. Part of that plan really has to be getting everyone on compliant. And I've heard the line, "Oh, they should come back when they learn English." Well, somebody's in your ER. They need services now, not 5 years from now. When they've got enough 10 years from now, have time to perfect their English, right? They need the services now.
Well, and you brought up a couple of points that I want to dig deeper into. So people that are persons and that are entitled to language access, does the law, do the guidelines, laws, regulations, do they have any clarifications on, are they entitled to good language access? Are they entitled to timely language access? Well, if Maria shows up to the doctor's appointment with her son to interpret for her, well, that's language, she has an interpreter. She brought her own interpreter. Well, what are the kind of specifics around that? And Carol, I want to turn it over to you first.
Yes, I mean, the Executive Order 13166 talks specifically about meaningful access, and meaningful access means have a qualified interpreter or a qualified translation. So if Maria comes with her aunt or her daughter to interpret, that is not going to fly or should not fly because the daughter is not a trained interpreter. And it's very important that we understand that with effective communication or with meaningful access, quality of service, of communication service is included there. So I think one of the biggest gaps, unfortunately, is precisely that. People tend to think that a language access plan is having a bilingual person, for example. And I have actually had clients that say, oh, no, yeah, we're good with the language access plan because so-and-so speaks Spanish as well. So we need to understand language access as a much broader kind of service that includes any language that comes through the door, right? How do you access, how do you help that person access an interpreter? How do you access an interpreter? Because remember that interpretation services is not only for the limited English proficient person, it's also for you who don't speak the language of the person that you are seeing. So how do we make sure that a person that comes through the door has language access, has an interpreter, and that interpreter is qualified and is going to be able to do a good job for the context where they are. Now, that's why there are specialties within interpretation as well, right? A medical interpreter might not be qualified to interpret in the courts or in an educational setting, right? So yes, to answer your question, there is language in those, in at least in executive order and also in the Affordable Care Act 1557 about effective communication and qualified interpretation services.
And I really
qualified bilingual staff. And I want to just pick up on that for a second.
Please.
There's now in the new regulation a clear definition of who's a qualified bilingual staff member. It's not just being bilingual; it's being a demonstrated ability to interpret, follow an interpreting code of ethics. Mm-hmm. And when you're using bilingual staff, so first off, it raises the bar. It's now in line with what the Joint Commission on Accreditation describes for qualified bilingual staff. Second, that bilingual staff person, they've got another job. I'm pulling Carol off of her role in as a surgical nurse, or I'm pulling Tucker out of his role in the billing department, and that other job isn't getting done. And so it can be, it doesn't cost us anything. Well, actually, there is a cost, and you have to be very careful as when you're putting together a language access plan, as to thinking through what the implications of using your bilingual staff to provide language access are. And it's also really important to note there are significant restrictions in the healthcare language access regulations on the use of minors and family members. Minors, if and only if, is an absolutely exigent situation, and only until an interpreter can be found, not as a matter of routine course. Asking a child to do something that they're, emotionally, cognitively, maturationally not ready for, certainly probably don't have the knowledge of medical concepts and terminology. But it's also important when you talk about who's a qualified interpreter. And I know we're focusing on medical language access, but it applies to all types of language.
I think Bill's giving us a live demo of some of the problematic aspects of having video remote interpreters too,
right?
Because maybe you can talk a little bit about that, Carol. Like,
yes,
in-person interpreting versus remote and Zoom interpreting.
Yes, in-person interpreting is when a person comes to the site and provides interpretation services. And the pandemic showed us the challenges with in-person interpretation. So thankfully, technology was already available to provide video remote interpreting and telephonic interpreting. And this has been a good solution for languages of lower diffusion, for example, where you cannot have someone on site. But it is important to also remember that you shouldn't indiscriminately use video remote interpreting, for example. You should be able to triage what is it that you need at the particular moment and how to better use the resource, right? Let's say, for example, on a hospital. If you are going to provide interpretation services for a person that is dying, a terminal patient. You wouldn't want to have a video remote person going in and out of the session, right? Like, you wouldn't want that. You would want an in-person interpreter. So there are certain guidelines on when to use video remote. It shouldn't be indiscriminately used. You should put your common sense to operate when offering those services. And I think we also mentioned the very few exceptions when to use children, but let's underscore the fact that, and this is also written in the new regulations with the Affordable Care Act 1557, that children should not be used for interpretation for the reasons that Bill mentioned, context, and also not only context and the difficulty of language, but also the fact that you could potentially traumatize a minor because of the context and we don't ever
that
know.
responsibility.
We're imposing that responsibility. So we need to change a lot of things in our approach to language access. Who is qualified, what is being qualified, who should provide the language access service, and the impact of not providing language access to both the person that you're serving and also your own company or organization.
Yeah, and I want to go back to, you mentioned earlier, Carol, you made a comment that's saying not just the person receiving services needs interpretation. You also need interpretation as the English speaker, as the American. And this is a good point. And I want to, because we haven't mentioned this, but question, what's the official language of the United States?
There is not official language in the US. And and this is an amazing question because it helps us really get out from that bias. I think there is a pervasive bias about like, well, if you're coming to the States, you should learn English. I'm not against you learning another language. I lived in different countries and I strive to learn the language of the country, right? But our founding fathers didn't define a language, an official language, because we have been multilingual since the US was founded, right? We had a fifth of the population of the US that spoke German at the time of that we became a country. So there is no official language. Let's know that for a fact. So with that, we have to be more open to the idea that we have a responsibility as professionals, right? If you are in any public service, right? If you are a social worker, if you're a nurse, if you're a doctor, if you're a teacher, if you're an attorney, if you're a pharmacist, you have also an ethical obligation to provide effective communication to your clients. I read all of the codes of ethics of all of those professions to set up my course. And all of them have some canon on effective communication with the community. So if your community has at least 9% of the population that speak no English, what are you as a professional doing to better serve them? So I think we need to flip the coin and the responsibility in that direction and really help people, professionals, understand it's up to me to be able to communicate effectively with this person because it's my code of ethics, right? It's not only, oh, let's be nice to the people that don't speak English or not only about let's follow the law, but let's follow my own code of ethics. And that also could help turning inward when we provide these services, right?
Agreed. Yeah. And that's why I asked, right? Because it's not the patient that needs interpretation. It's you that needs interpretation too. You both need interpretation. This isn't, well, they don't speak English, so therefore they're the ones in need. No, there is no official language of the United States. There is no expectation, legally binding expectation that people learn English to be here. And I think it's an important mindset to have, right?
Yes.
We're not doing these immigrants a favor. We're not being nice to them. We're just being non-shitty human beings. You know what I'm saying? We're doing the bare minimum.
Yes, I couldn't say it better, Tucker. I think that we have this idea erroneously that, we're, oh my God, they don't speak English, so we're doing this favor to them. It's not to them. It's really about about our own code of ethics.
Or they're getting something extra that I'm not
Yes,
getting.
exactly. It's nothing
Right.
extra. It's effective communication. Unfortunately, the US doesn't have a very we're not forward thinking in the way of learning other languages. And I have to congratulate Bill for doing so much advocacy when it comes to learning other languages, and the US is really behind that, right? And that's why in the US, the question is that of being, should we all speak English in the US? Shouldn't we speak like at least 3 different languages in the US, provided that we have so many languages in the US already? Shouldn't we actually encourage people to learn other languages? That should be also part of the conversation.
You know, there are these perceptions out there, right? And stereotypes and prejudices. And that's why we have Civil Rights Act. That's why we have Executive Order 13166 that Carol mentioned about language access, which clarified the Lau v. Nichols Supreme Court decision and applied it. The decision that equated discrimination based on language access with national origin discrimination, which is expressly prohibited. It's why we have Section 1557. It's why we have the Americans with Disabilities Act. Now, I was much younger when that was passed, and there was a lot of, I think 1990, there's a lot of pushback. Oh, now we're going to have to install ramps and put, handicap parking spaces. And, people who might not remember what it was like before that was passed might not remember that discussion. Take it for granted, right? That we have, that if you have a physical handicap, you're going to be able to access the grocery store, the church, whatever it is. And I think we're, 10, 15 years behind in terms of setting things up for language access. I mean, there's one of the things we've been successful in advocating for is the creation of the universal language access symbol. So you think of the handicap symbol, which is it's an icon. It's literally an icon, right? And it points. It makes it very clear that the blue stick figure sitting in a wheelchair, actually designed by a professional graphic designer in Scandinavia about 60 years ago. We need something like that, and used and understood by the service providers and understood by the community, so that it's just as just like, okay, I expect there's going to be a ramp to get into the giant in Bethesda, and there is, right? I expect that there will be language services, language assistance services, as called in the regulation, available at the hospital and or at the doctor's office, pharmacy.
Yeah. And going back to some comments at the beginning of the session when we talk about the deaf and hard of hearing, for example, if there are a lot of things to learn about that community and also the way it is implemented to have language access, in that context. I think if we focus, for example, in, okay, the idea is not to discriminate, and then from that, have the expectation to have adequate language access services, right? Which means having interpreters that are trained and professional. Because, for example, that is certainly an expectation that a person that is deaf or hard of hearing will have, is to have a professional American Sign Language interpreter, right? And then we should have the same expectation about a language interpreter. And then if we do that, if we raise the expectation both from the side of the limited English proficient person and from the side of the professional, right? Then it's not only good for the limited English proficient person, but it's also good for the profession of interpretation. And let me give you an example. For example, the Maryland courts, right? If you are an ASL interpreter, you have different, or you used to have, I'm not sure if now it's exactly the same, but you used to have a different number of hours that you were able to schedule yourself, right? And and it was better than language interpreters. And language interpreters have been fine with that. And I wonder why. Like,
well, they aren't anymore.
Providing the same services? What's
Yeah, at
that?
least in Maryland, they aren't anymore.
Right, exactly. But the question hasn't been asked so much. Like we should have the same level of payment or resource allocation, because we're essentially doing the same. So it doesn't matter whether we go under this law or this other law. What matters is that we should prevent discrimination, and for that effect, we are both doing the same. We're interpreting, we're professionals. So if we increase the expectation of what an interpreter should do, right, then that profession, especially with the language interpreters, will also improve. So it will be good all around.
All good points. We spent a lot of time, I'm just watching the clock here, we spent a lot of time talking about kind of the need for language access here, which is a very important topic, and I think everyone here is very passionate about it. But moving back to language access, how do we create a language access plan? How do we create a language access policy? There's resources out there, like lep.gov is a great resource. There's templates to use. There's guidelines. Now, that having been said, what's the big deal with creating a language access plan? Why does Nimdzi work with different, on 9-month projects to work with different state, county, cities to create customized language access plan? Why can't everyone just kind of have the same language access plan, Bill?
Well, because, every place is different. 56 states and territories, they're all different in one or another ways, in terms of how they're organized, the laws that govern them. Like working in California, we also have to take into, we've done a couple of plans for California municipalities. California's language access law. Now, working with another state, they may not have a language access law. The populations will be different. The makeup of a place, how rural or urban is it, will differ. I mean, as I said before, America's diverse everywhere. That means places like, northeastern Maine, which is really rural, you're going to have a different approach than you would in San Francisco or Baltimore, because you're not going to have the population of interpreters aren't going to be in the same place as the speakers. And then you really have to get into the nuts and bolts. How is it delivered within your organization? That's the plan. Policy is important. But the plan is what we're going to do. The plan is how are we going to do it. That has to be tailored to pretty much every state agency, every county, every city, so that they get it right in their context. There are issues that come up, like Carol's talked about the balance between remote and on-site interpreting, which is a really tricky thing to work through. There are very small language populations. Just because you've only got 2 or 3 speakers or 5 families in the state speaking that particular language, still got to provide access so we can find interpreters. There's the need for relay interpreters. If you've got a Triqui or Chetino speaker, you're going to need someone to go from Chetino, these are indigenous languages of Oaxaca and Chiapas, Guatemala. You're going to have, a relay interpreter, a Triqui Spanish, English. Oh, I have to pay for 2 interpreters? Yeah, you do. We see an increasing number of deaf individuals coming into the country. Well, British Sign Language and American Sign Languages are 2 completely different languages. They're not mutually intelligible. A deaf person from Britain can't communicate, in ASL unless they learn ASL. They may have BSL. So you've got to handle that. You need 2 interpreters, probably a certified deaf interpreter and to ASL and ASL to English interpreter. It's those kinds of details. And then you've got to have the training. And, Carol and I agree completely on this. You've got to have the training, and it's got to be recurring training. And then you've got to have the platforms and the things in place. All of these things have to be there so that when that person steps through the door to sign up for the state Medicare or Medicaid, to, fill out a permit to hold a quinceañera at the local park, that you've got the person that they're dealing with can push the button and get the interpreting,
Yeah.
and hand them the the application to take, the state general contractor exam, hand that application out to them. It's the Spanish version of that application. That has to be there. You have to be able to print it out and hand it to them. And that's where the plan really comes in. It's the details, the nuts and bolts.
Yeah. And also seeing it from a macro perspective, I think that the 4-factor analysis that the Executive Order 13166 offers as a tool is very useful. Like, do you understand the proportion of the population that you have that speaks another language? What is the language? Then what kind of service do you provide? Is it an urgent kind of service? What is the other thing? What kind of resources do you have, right? And so once you have answered these 4 different things, then you can say, okay, well, it turns out that my service is, let's say, helping people with that are homeless, right? And the proportion of the population that come to my door, the majority of the limited English proficient person speaks Spanish, for example. But I am an organization that just receives funds through grants. So can I get a grant to get connected to one of these language services, like, for example, Equal Access, that offers interpretation over the phone or video remote, because that's the resource I can pay for, right? So if you do it, I mean, there is a simple way to do it that, again, follows common sense, and it's already written in Executive Order 13166. You can also use that to create your own language access plan. But again, and I emphasize what Bill just said, that goes nowhere unless there is training and repetitive training, right? Just the same way as we use today hand sanitizer, and we know how good it is to kill germs because it has been bombarded to us every day. We should do the same with language access. It's just, it cannot be one and done. It has to be constant training. And I am glad that the ACA 1557 is emphasizing on training. Everybody should be trained all the time. Yeah.
Yep. It is a new requirement in the regulation. It's annual training for anyone who needs it. It's there's I mean, I'd love to dive into details, but there's a lot of nuance, and there's a lot of expertise that organizations like Nimdzi have, organizations like Carol's organization has, in how to actually get language access to the people who need it. And there's kind of second order things. So if you're putting out an RFP for language services, what needs to go in that RFP, right? Whether it's translation, interpreting, remote, etc. How do you effectively deliver remote interpreting, to somebody who's bedridden? Okay, you've got somebody on iPad, and if they're deaf, they need to actually see that person. So how are you going to do that? There are all sorts of nuances and details. And I know we're not supposed to dive into details, but the big picture thing is you've got to, you're better off reaching out to somebody who knows how to build these plans and implement them than trying to do it yourself.
Or also,
it'll save you a lot of time and money and grief in the long run.
But also answering a very simple question, like, how we see people with shirts that says, "What would Jesus do?" Like, what would I do if this was an English speaker, right? And if you're treating that person exactly the same as an English speaker, then you're providing effective communication, then you are providing effective language access. So that simple question will help a lot. But I agree, like, get all the resources that you need, all the expertise that you need.
And I don't think we've mentioned, common sense more than a few times on this call. It's just kind of common sense things that we need to do. I don't think the challenge is a lack of common sense. I think most people have common sense. That's why they call it common sense. I think it's just ignorance. And I don't mean that in like a judgmental meaning of the word. It's just people don't know what they don't know. So if I don't know, if I'm not part of the language services industry, if I haven't been doing this for 2 decades, like, my common sense would say, wow, they have this cool thing called machine translation, right? And sorry to bring that up with like 3 minutes left in the podcast, but
so
talk about that for a little bit.
One of my many unpaid volunteer roles, I'm chair of something called the Safe AI Task Force, stakeholders advocating for fair and ethical use of AI and interpreting. AI is, the large language models are actually an outgrowth of machine translation models. Same statistical reasoning, same prediction of language, just vastly fancier and more complex. But even, and they talk about hallucination, right? Well, Google Translate's an amazing technology, but it makes mistakes. It made mistakes before AI infused it, and it makes mistakes now. I'm going to give Carol a sentence in Spanish and ask her what she thinks the original was in English. La vacuna no se necesita.
You don't need the vaccine.
The original English is the vaccine is not mandatory. And this was talking about COVID vaccine. This was on a state Department of Health website. And a colleague of mine who is a translation professor had a student bring this to her attention, called me, and that led to eventually a civil rights investigation. And 19 state departments of health stopped using raw Google Translate. And the new rule says if you're using Google Translate, you have to have a qualified human translator review it.
Yes.
Any kind of machine translation.
And I have to add something also, because the issue of accountability is important. No matter how good the machine translation turns out to be, who is going to be accountable for that translation?
If something goes,
and that is why, right, if something goes wrong, who is going to be responsible for that? So even if it's excellent, we cannot get rid of the human who's going to take the blame. No,
well,
I mean,
and Carol, I gave you a perfectly grammatical sentence, perfectly comprehensible sentence in Spanish, which is my fifth language. You don't know what's wrong unless you see the English original and you can read the English original, right? So the danger of using raw machine translation, raw AI, and at its core, if you're using AI for interpreting, at its core, it is still machine translation using voice recognition, a machine translation, and a voice generation, right? It's all called AI, but the core technology is still a type of machine translation. You may not know it's wrong unless you're highly proficient in the source language. So that's the danger that you have with MT and AI. Do humans make mistakes? Oh, sure.
yeah.
But we usually recognize them. Like when I was an interpreter, I made a mistake. There were lots of cues, like a confused look from the audience, or, oh, damn it, did I just say that wrong? That little oops goes off in the head. I can go back and fix that. Even as an interpreter, you can restate it. Translate, you've got time to review it. Machine translation, AI, they're not self-aware. They don't know they made a mistake. They can't see the look of puzzlement or bemusement or irritation on the face of the people in the conversation.
Yeah, true.
It has a lot of promise, but it's not a replacement for humans. And
Yeah.
I don't think it ever will be.
And
What's that?
And this is why a language access plan, an implementation plan is important, because yes, we all know this. We're preaching to the choir here. I'm guessing anyone that listens to this podcast probably knows this, but does the frontline worker at the licensing office know this? No, right? If the secretary at the DOL, his boss tells him, like, you need to, we have a Spanish speaker, like, his common sense is going to be, okay, I'm just going to run this through machine translation.
Yeah. And now that you mentioned common sense, Tucker, I think that the point is that it should become common sense. I don't think it is yet, actually. I think the idea is that we change our culture so deeply that it becomes common sense. In other words, that just as today we know what to do with the hand sanitizer, at some point we will know what to do. Anybody could know what to do when a person that doesn't speak English comes through the door. I know, I mean, and that's where the work is. This is why I'm fascinated about doing this work, is because we need to teach so much, and there is not yet a critical mass that understands the need for language access, but the idea is that there will be, and that at some point the culture will change and it will be common sense.
And you're that senior manager who decides, hey, Google Translate looks free, output looks pretty good, I can read it, I try it from Spanish to English or whatever. You don't know, you may not know the regulation, and that's
Right.
that ignorance. My first scoutmaster 45 years ago told me ignorance is when you haven't had the chance to learn something.
Right.
Stupidity is when you have had the chance to learn something.
I love that.
And
I'm stealing that.
or you may not know that just because someone's last name is Sanchez, you may not be a Spanish speaker.
That's the other thing. It's
right?
like we look at someone and we assume, oh, this person speaks Spanish, and there's a lot of languages spoken in Central and South America, and
you may not
Mexico too.
know that.
Or on the other hand, oh yes, I spent 2 weeks in Costa Rica. I speak Spanish.
Oh, that's my
I was
favorite.
an
That's such an American thing. It's like, oh, I took 2 years of Spanish in high school. I speak Spanish. It's like, honey, I don't.
Yeah,
You really don't. Just because of your mission trip to Nicaragua.
Right.
But-
and on that, we should apply the government standard, unless
Right.
you pass like the ILR test at a certain level,
ILR
you cannot be
3.
speaking.
Yeah, it's basically ILR 3 to be an interpreter. You have to have professional level skills.
Exactly.
And that's a pretty high bar. You're not getting that out of 2 years of high school or even 4 years of college.
Well, I'm watching the clock here. We're over time. We got a little bit of a late start. We had some issues with the connectivity, the stream, and stuff like that. But we got this recorded. We're gonna slap up the full recording afterwards. But before we go, we talked a lot about training. We talked a lot about the need for ongoing services and stuff. And I want to give you the opportunity, Carol, to talk a little bit about what you do. What is Equal Access Language Services? How can people get a hold of you? How can people give you money to solve their problems?
Thank you. Yes, Equal Access Language Services is an organization, or a company rather, whose vision is to end language-based discrimination, and we are completely devoted to training organizations and companies on language access. So we have developed comprehensive language access training that debunks certain biases that we have about language, and it tells you step by step how to implement language access, who the person with limited English proficiency is, etc. And I also want to invite people to listen to our podcast that talks a lot about language access. It invites experts. Bill is in one of the episodes, experts on language access, to talk about language access and how they implement it in their industry or in their company, and also about the laws on language access. So I hope people listen to it. And sure, call me. I think my contact is there, and I'll be happy to work with you.
We should ask our friend from Maine to see if she wants to go on Carol's podcast.
Yeah.
Please suggest people.
That's awesome. Yeah. So Equal Access Language Services, all one word.com is where you can find more about Carol. Bill, I don't even know what to ask you to plug. You're involved in so many what's the initiative of the week that you're working on?
Oh my goodness. In no particular order, there's a request for comment from Consumer Finance Protection Bureau on language access and mortgage servicing. I'm working on that. I spend about half my time lobbying and for the language industry and for some companies mostly in the online learning space. And we're working very hard to get funding into the system, as I said, for things like the universal language access, for demonstration grants for language access and education, which is actually really complex. Language access and education being all sorts of different scenarios and settings, and a very broad set of terminology. And in terms of language access itself, I'm always happy to talk to folks about this. I would plug Nimdzi, because we've gotten really good at doing the needs assessment at a large organizational level and coming up with the plan, the policy, and the plan to make language access happen. It's something I've been working on and off since 2000, when Executive Order 13166 was first promulgated. President Clinton signed it August of 2000, and it's such a dynamic space, the language industry, and there's so many really cool people in it. And I'm happy to help out whenever needed. Of course, I'd like to get paid too. So
of course, and we try to pay you when you work for us. But sometimes
I've enjoyed the work with Nimdzi. I think we've developed some really good expertise on
Yeah, I feel really good about
municipal
the
and
work.
state level.
Yeah.
Municipal and state level putting plans together.
Yeah.
I
So
think we should all work as a team, actually.
I would love, that's the dream team. I would love to find so keep your eyes open for those RFPs. I'd love to find a project where we could all work together. I think that would be a lot of fun. Solve some problems together. So,
Yes.
guys, thank you so much for joining us. I feel like we just scratched the surface today. But yeah, if folks out there want more information, I think you know where to find us. equalaccesslanguageservices.com. Bill's all over the place. Just search for
I'm on LinkedIn.
Bill
LinkedIn
Rivers.
is the best place to get me.
LinkedIn's the best place to find Bill.
Yep.
Nimdzi, we're all over the place too. Follow our LinkedIn page, subscribe to us for all of that good stuff. Blah, blah, blah. Shameless plug. I'll close us out today. All right. Thank you, guys. Thank you, everybody, in joining us live today. For joining us. It's time to end this Nimdzi Live experience.
Right.
Join us next time by joining us on LinkedIn, following us, so that you can be aware when we schedule Nimdzi Lives. I appreciate our guests today, Bill and Carol. I appreciate all the folks behind the scenes here making this happen. I appreciate my colleagues doing all of the research so they can support these interesting conversations. And I appreciate you, the audience, for joining us live and all of the comments, which we didn't get to. I look forward to next time. Cheers.
Thank you.